More than half the time, the conversation's with the family. Most of the time, patients are so incapacitated, they're on drugs or they're demented. Oftentimes, I'm speaking with the families and I'm guiding them like, this is what's going to happen. Most of the job is counseling families. We've had a few cases with some younger folks, so that ended up being more counseling the patients themselves. Look, most hospice is not younger people, it's older people. Our geriatric population is very big. We have a very sick population of older people. Our population in general is only getting sicker because we are living a bizarro life. Most of the time, it's like got a 70 or 80-year-old lady or man, and I'm talking to their 50-year-old kids. And oftentimes, they never even thought about it. They never even talked to them.
Last year, had a patient who found herself at this end stage. It was also pancreatic cancer, and she was receiving care of a care provider. She found herself alone. Her sons were not supporting her in a way that she felt comforted. She was a widow, and she was very, very scared and had these conversations with me, and they had not initiated any real, they had some hospice, but no one was having the discussions with her. And so for me, that was very difficult as well. I didn't know how to handle it. So what I ended up doing was bringing up videos where people have done these great interviews and discussions about near-death experiences and how beautiful they are. And I sent her some links. She started watching and listening to them. It was a tremendous support for her. How do you go about calming someone down about the actual dying process?
First of all, if a provider hands someone information about medical aid and dying, and they haven't initiated hospice where you have a social worker, a chaplain, a physician, a nurse having these conversations, it's a huge disservice. So if this lady was on hospice and these conversations didn't have, the hospice failed her. Hospice is not just providing drugs and a nurse to show up. It's a full team to guide. Here in Los Angeles, I have a team of board certified physicians, and we take pride in being actively involved. There's some cases where everyone gets it and we don't have to do anything. And there's some cases, like I just have one meeting next week, where there's 7 siblings and 2 of them get it and 5 of them don't get it, and the family member's demented. And I'm like, we're sitting down, everyone get on the call, we're all having this conversation. It needs to happen. We need to all be on the same page. This sibling knows and had the conversation. You guys aren't listening to this sibling. You need to listen to this sibling because they know what mom wanted, and that you guys need to listen to what mom wanted. That is the rule in end-of-life care, is you do what the patient wants or would want, not what you want because you're guilty that you haven't seen her in 5 years. And we see that all the time. It gets very selfish and weird when people approaching death and no one has addressed it. So frankly, the answer is change hospices and have those advanced care planning discussions.